Glaucoma is a disease of the optic nerve. And a lot of people might have glaucoma and they don't even know about it because it gradually, very subtly, takes away their vision. But it does it without pain. You can have glasses and you wouldn't even know about it. So there may be a lot of patients out there that don't even know they have glaucoma.
So how do you find out if you have it?
Good question. The best thing to do is just have your annual eye exam, and they'll pick it up during the eye exam. When we're checking the eye pressures and the overall health of the eye, we'll pick it up at the annual eye exam. So make sure that you get in for your annual eye exam.
And what does this affect? I mean,
so it's really important to get it screened for that, because gradually the patient will lose their vision. And if you look here on this screen again, so
you're going to tell me how this happens.
Correct.
It makes me nervous.
This is a cross-section of the eye, and the optic nerve's way back here in the back of the eye. The retina, which is really a whole bunch of tiny little nerve fibers, coalesce to form this optic nerve. And so if you look here at the optic nerve, this is a kind of a head-on shot of the optic nerve. It's a bundle of tiny little nerves, and this runs back to the back of the patient's brain, where it's interpreted, where all those little electrical signals are interpreted into images so we can see. So glaucoma is a disease of this nerve, and over time the nerve starts to die off, and it'll start having less and less tissue, and this little circle in the middle will start getting bigger and bigger over time as the patient loses vision. But they may not even know that they've got it, because you lose vision from the outside in, and so most people wouldn't even know that they've got it because it's their peripheral vision that's affected first.
So what would be some of the first signs you might think about if you should go get checked because you're having these problems?
A gradual blur of your vision. Your vision might be a little bit more dim than it was before, or in one eye more than another. Sometimes you can even get a little eye pain with glaucoma if the pressure in the eye is too high. So a lot of times when a patient will come in, we always check the eye pressure. And we check the eye pressure because that's one of the things that we can use to determine if the patient's got glaucoma. It's not a cause of glaucoma. We're not exactly sure what causes glaucoma, but it's certainly a risk factor in glaucoma.
Do you see a lot of people with patients with
Yes, there are a lot of patients that have glaucoma, and there are a lot of patients that, again, may have glaucoma but don't even know about it. So it's one of those things that's really important to get screened. The way we treat glaucoma is we lower the eye pressure. So we use drops first. If the drops don't work, there are a lot of new laser procedures that we can do, and a really great procedure that's just come out called canaloplasty. And canaloplasty is a way that we can open up the drainage canal inside the eye and lower the eye pressure without having to use medication.
And you do have a laser here, so you have the opportunity to use it.
We do have a laser here, however, it's not that kind of laser, but the hospital has a laser.
And so you set up appointments, and
Yes.
Do you do the surgery?
I do.
You do?
Uh-huh.
And what does that entail, that kind of surgery?
So it'd be an outpatient procedure. We go in the morning, and the laser procedure is usually just a 15-minute procedure. We kind of schedule an appointment through the outpatient services at the hospital, and it's quick and easy. The actual surgery to lower the eye pressure can take a little bit longer. It's about an hour-long procedure. It's kind of technical, but it's very successful. Patients do really, really well with that. It lowers their pressure nicely so they don't have to use drops.
So say someone has these symptoms and they think, okay, I might have this. I need to go get my eyes checked. They come in here, you say yay or nay.
Correct. And we do a whole bunch of tests to make sure that they don't...
A whole bunch, like how many?
At least 3 or 4.
3 or 4. And what are those tests?
So we test their vision.
Okay.
We test their eye pressure. We test their corneal thickness on some of our machines in the back. And we take some pictures so we could have documentation that shows stability over time.
And what are the age ranges? I mean, we all think, I'm young, I can't possibly have this. What are they?
Glaucoma can affect any age, from little tiny babies to old folks, so it depends. But majority are kind of the middle age.
And you do a lot of different things here. You do LASIK. Tell me all of the things that you offer here.
So we do LASIK, we do cataract surgery, we do glaucoma surgery, we do pediatric eye exams, strabismus surgery if there's crossing of the eyes or any problem with a child's eyes, we'll fix that. And we do lots of routine eye exams as well.
From ages from young babies to 100.
Correct. Any age group.
Yeah. And you offer glasses, what other,
Contact lenses as well.
And you're easy to find. Tell me again where you're located.
120 West Cache Valley Boulevard. It's right across from Sam's Club, and it's easy to find if you turn at Sizzler.
And you have a great resume. I was looking over that thinking, man, you've done a lot of laser surgeries, and I know you're not going to toot your own horn, but tell me how many surgeries you've done and where.
Goodness, thousands of cataract surgeries, thousands of LASIK procedures. I've been sort of all over the world in the Army before this, so it's good to come home, though. I'm from Cache Valley, so it's nice to be home.
It's nice to have you back. Thanks, Dr. Hammond. Appreciate it.